Hi, I'm Dr. Yen Reyes. I'm an infectious disease specialist and a pediatrician. I will be talking about medical updates, lifestyle, and health. So please subscribe to my channel and click the notification button.
Good day. I am Dr. Yan Reyes. I'm a pediatric infectious disease specialist. As of today, November 10, 2021, a lot of parents and fellow doctors, mothers and fathers, friends are still calling me or texting me asking for my opinion if bibigyan ba nila ng COVID vaccine ang kanilang mga anak, and they're asking for exact scientific evidence kung talaga bang safe, effective, or immunogenic ang mga COVID vaccines for 12 to 17 years old. I understand that those kids are really precious and we really have to decide on whether to give vaccination for them. So I'm showing you some of the scientific evidences. So I will talk about our local experience with COVID vaccination in children, ano yung mga comorbidities, what are the requirements, and evaluation of the Pfizer and Moderna vaccines na siya lang yung pwede sa kids 12 to 17 years old. So here are examples of the COVID vaccination for teens. Most of the time, there are pediatricians na nagmaman sa screening at saka adverse reaction area. So sa start ng COVID vaccination, October 15, 2021 in the Philippines, nagpa-prioritize tayo ng mga may comorbidities kasi studies have shown in these 42 articles na kung sino yung may mga comorbidities, 5.1% ang chance sila na magkaka-severe COVID compared to walang comorbidities na 0.21%. So, you already know na ito yung mga comorbidities na pinaprioritize. So, in the Philippines, they already said na kung sino yung may comorbidities, sila lang yung kailangan ng medical certificate and medical clearance also with DOH stamp. Pero yung mga patients na wala namang comorbidities, no need na for medical certificate. Ang kailangan lang nila yung certificate of filiation. Filiation is dapat meron lang sang birth certificate as proof na anak sila. At saka birth certificate na ano yung date na kailan sila pinanganak para makita talaga yung age nila na 12 to 17 years old. So ano yung mga may comorbidities na kailangan ng medical certificate? Sila yung may medical complexity, like yung mga naka-tracheostomy, yung mga genetic conditions like yung mga Down syndrome, G6PD, o kaya any thalassemia. Neurologic conditions like yung mga may seizure, may autism, cerebral palsy, yung may stroke in the young, metabolic problems like may diabetes kasi may mga bata na rin na may diabetes ngayon, hypothyroidism, or hereditary metabolic diseases, mga cardiovascular diseases, mga may sakit sa puso like hypertension, congenital heart disease like common yung mga ventricular septal defect, ASD, atrial septal defect, may mga rheumatic heart diseases, like yung mga may comorbidities, obesity. So pag more than 95% yung percentile mo sa weight, obesity is kasama din sa comorbidities. Kailangan din siya ng medical certificate. At saka HIV infection. So ano pa? Tuberculosis. So TB of the central nervous system, bone, joints. May mga chronic respiratory diseases like bronchiectasis at saka yung mga person na may bronchial asthma. Kailangan ng medical certificate. Renal disorders, yung may mga chronic kidney diseases, tapos sino yung mga nakadialysis, mga hepatobiliary diseases, yung may mga sakit sa atay, cirrhosis, at saka immunological state, kung sino yung mga patients na may mga leukemia, anemia, thalassemia, may lupus. Yun yung mga comorbidities, kailangan lang ng medical certificate and medical clearance. So, ito yung itsura ng medical certificate na kailangan. So, meron siya nakalagay dito 12 to 17 years old with comorbidities. So, it's important to meron lang seal ng Department of Health. So, kung wala ka namang comorbidity, yung documents lang to prove filiation, yung mga birth certificate o kaya marriage certificate ng parents mo, at saka consent forms. Yung consent forms, yung nagko-consent yung parents mo, at saka assent forms, yun yung nag-a-assent or pumapayag yung mga children 12 to 17 years old. So ito na yung mga vaccines na meron sa Philippines. Pfizer vaccine, AstraZeneca, CoronaVac, Gamaleya, Janssen, the Bharat, the Moderna, the Sinovac, at saka the Sinopharm. Pero yung allowed lang sa mga children 12 to 17 years old ay yung Pfizer at saka Moderna vaccines. So, lagi namang tinatanong, laging tumatawag, which is better, Pfizer or Moderna? So, I'm showing you scientific evidences na journals talaga about Pfizer and Moderna vaccines. So, yung Pfizer vaccine was approved January 14, 2021. mRNA vaccine siya. So, these types of vaccine, I discussed this in my previous vlogs, kung ano yung mga type of vaccines para sa COVID. So, age group na allowed, 12 years old and above. Frequency niya 2 doses, 21 days apart. So, dapat matutulong kayo na mag-compute na 21 days yung pagitan or more. So, vaccine efficacy niya for 16 years old and above is 95% and 100% for 12 to 15 years old. How about the Moderna? So, yung Pfizer, January siya na-approve. Ang Moderna naman na-approve is May 5, 2021. mRNA din siya. So, 12 years old and above pwede. So, ang frequency niya is 2 doses, 28 days apart. So, like for example, December 1 ka mabakunahan, plus 28, December 29, yun na yung next dose mo. So, it's also important that you have to compute also or help the persons in charge to compute. So, kasi minsan kasi may mga human error, dapat alam mo rin na kung Moderna, 28 days, pag Pfizer, 21 days. So, on clinical trials, 94% ang kanyang vaccine efficacy against symptomatic COVID and 100% against severe COVID. So, ano yung mga common side effect? Mga pain, erythema, swelling on injection site, yung medyo masakit siya. Kasi usual naman yan sa mga regular vaccine reaction na masakit siya. Tapos minsan iba nagsiswelling. Ang iba axillary lymphadenopathy, magkakaroon ng kulani. Yung iba may headache, sumakit ang ulo, fatigue, fever, or chills. So, let's evaluate the Pfizer vaccine in adolescents. So, ito na yung study from the New England Journal of Medicine. Chine-check nila yung safety, immunogenicity, and efficacy of the Pfizer vaccine in adolescents. So, as I mentioned, kaya gusto nyo na scientifically based, dapat evidence-based. So, ito na yung pinakamagandang journal for that. So, they studied 2,306 adolescents, 12 to 15 years old, 2,264 randomized across the U.S., and 131 received the Pfizer vaccine and 1,129 received the placebo. Placebo is yung wala siyang vaccine mismo. Pwede siyang starch na yung hindi naman nakakasira or water lang or distilled water lang siya. So, 97% nagka-receive ng dose 2. So, ano yung safety? So, nakita nila na ang adverse events, so nagkakaroon ng mga fever, chills, headache, 6% lang sa naka-receive ng Pfizer vaccine. And in 16 to 25 years old, 11% lang yung nagkaroon ng adverse events. So the rest of the population, hindi sila nagkaroon. So wala silang hypersensitivity nakita at saka no deaths were reported to the children given the Pfizer vaccines. So, ano yung efficacy? Efficacy is i-check mo kung efficacious ba siya, kung effective ba talaga yung vaccine na yon. So, they noted na no cases of COVID-19 with an onset of more than 7 days after dose 2. So, pagkatapos ng dose 2, wala na silang nakita na nagkaroon ng COVID-19. However, 16 cases were observed among placebo recipients. So, yung mga nabigyan ng hindi COVID vaccine, like for example, yung isa COVID vaccine, ang isa distilled water lang, yung iba ko na placebo lang yung binigay, 16% nagkaroon. 16 cases ang nagkaroon. So that means the observed vaccine efficacy is 100%. Kasi nga, wala nagkaroon ng COVID eh. So 100% yung efficacy. So another study was done for 12 to 15 years old, 2,229 yung adolescents. So, they noted also na yung vaccine efficacy was 100% after dose 2. Okay. So these are the side effects na makikita. So this is a little bit busy pero ito talaga yung exact na sa journal. Meron ang iba nagkaka-fever in 17% of cases, 16 to 25 and 20% of cases. So ang iba fever, fatigue. Fatigue is yung napapagod, headache, sumasakit yung ulo, chills, nanginginig, vomiting, sumusuka pero konti lang. Diarrhea, ang iba nagtatae, ang iba nagma-muscle pain, nagjo-joint pain, sumasakit yung mga kasukasuan, at saka yung iba gumagamit ng antipyretic use. So, yung iba gumagamit ng paracetamol para sa pain. So, evaluate naman natin yung Moderna vaccines. Kasi dalawa lang naman sila eh. So, with Moderna naman, there is also from the New England Journal of Medicine, in-evaluate nila against SARS-CoV vaccine for adolescents. So last December 9, 2020 to February 28, 2021, they tested 3,732 adolescents randomly assigned 2:1 ratio. So, dalawang adolescent nakapag-receive ng Moderna, one nakapag-receive ng placebo. Okay? So, more than 98% received the second dose. Ito yung mga reasons bakit hindi nakapag-receive ng second dose yung iba. So, nagwi-withdrawals from the consent, 10 patients, and loss of the follow-up, 8 participants. So, ano yung mga most common side effects with Moderna? Usually, injection site pain. Actually, as I mentioned to you, ito naman yung common na pain, common na reaction after every vaccination. Pero yung mga most systemic reactions, ang iba fatigue, headache, myalgia, at saka chills. So, yung overall incidence ng solicited adverse events was between or generally similar kung 12 to 15 or 16 to 17 years old. So, immunogenicity. So, i-check kung immunogenic ba. So, pag-check nun, ginagamit lang geometric mean titer of neutralizing antibodies. So, they noted that ang serologic response niya was 98% among adolescents. So, ibig sabihin, immunogenic siya. So, i-check naman yung efficacy. So, they noted na 93.3% is in the per protocol population and 92.7% for cases with onset of 14 days after the first injection. So, in summary, this is the difference between Pfizer and Moderna vaccine. Both of them are mRNA. So, 2 doses, 21 days apart for Pfizer and 28 days apart for Moderna. So, age group, pareho silang 12 years old. So, vaccine efficacy, so Pfizer 95 to 100% vaccine efficacy and 94% for Moderna. And then, thank you so much for listening. I will talk to you in the next vlog about myocarditis, which you can see, and other rare side effects. So, I hope that you have learned a lot, and I hope that you will have your kids vaccinated, because for me, even if I have an only child, I have her vaccinated with COVID vaccine. Thank you so much for listening, and if you have time, please subscribe to my channel because I will be talking more about vaccination and other side effects with COVID vaccine in children. I'll be talking more about myocarditis, and then this is my advocacy, and I hope that you have learned a lot. Thank you so much for listening.